Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, it's been a while, and you were actually able to carry on without me?
I did.
Well, good for you. That's encouraging for the future, isn't it?
Don't talk about that.
Well, you know what? It's almost spring, even in Minnesota, and that means flower buds and blooming trees. But if you're one of the millions of people who have seasonal allergies, you do?
Yeah. Well, no.
It's not all roses,
I don't even
is it?
know exactly.
Well, you're coughing, you're sneezing, you're wheezing, you're congested, and your nose won't quit running. Is that true for you? It's not quite
Yes.
spring yet here in Minnesota.
Yes, and yes.
Really? Mm-hmm. Well, we've got a doctor who can help you with that. They're called seasonal allergies, and other people like to refer to them as hay fever or allergic rhinitis. And as you can attest, it can make you miserable.
Yes. So how can allergy sufferers find relief? Is there such a thing? Are there home remedies or medications that can help? Here to discuss seasonal allergies is family medicine physician Dr. Elizabeth Cozine. Welcome back to the program, Dr. Cozine. It's good to have you here.
Thanks again for having me.
Thank you, Dr. Cozine, for being here, especially at this time of year. So it's spring, almost, at least in Minnesota. Do you already have an office full of allergy sufferers?
Not full, but trickling in. And
It is
I
early.
think we had a relatively calm and quiet winter here in Minnesota. So I am seeing that with the warmer seasons that we've been having the last few years, that there are more allergy sufferers later in the fall and sooner in the spring.
It's any season, though. It can make a difference for people, right? It just doesn't matter. Everybody has their own time.
Yeah, absolutely. Some people have different triggers. So for many people, Dr. Shives mentioned the hay fever when things are starting to bud or leaves are falling in the fall, then people have more symptoms. But there are people who have allergens to sort of home things like dust mites or animal dander that have symptoms year round.
So why do they call it hay fever?
Hay?
This is not a farming segment.
I guess it wasn't that difficult a question, was it?
Well,
But actually, I think that's correct.
Yeah.
But the hay really doesn't start to bloom or seed or whatever until a little
Right.
later.
I think
right?
it's just
But-
a historical thing related to the season.
So when somebody comes in with a runny nose and congested and they're coughing or wheezing, and how do you know it's hay fever? I mean, how do you say, oh, well, you don't have a cold, you don't have the flu, you've got allergies?
Right. Well, usually in my line of work, we kind of take in the whole picture about what's happening. Typically, people that are coming in with allergy symptoms, there's something going on in the season. It's starting to warm up. People are outside more. They maybe started exercising outside again after being cooped up indoors all winter. So I help put that together. But you're right. Sometimes the symptoms can be a little bit tricky to sort out from an upper respiratory infection versus allergies. But the thing about treating allergies is that you just give it a shot and see how it goes.
Not a real shot.
Correct. Yeah, that would be the wrong thing.
But don't some people get allergy shots?
Yeah, that was a nice segue. I wasn't even planning that. But yeah, you're right. So if somebody has seasonal allergies that are not well treated by over-the-counter medicines, that would be antihistamines, non-sedating antihistamine like cetirizine, which is Zyrtec, fexofenadine, which is Allegra, or loratadine, which is Claritin.
And those are all over the counter.
Those are all over the counter. Among some other over-the-counter things, I might consider sending them to an allergist for what's called allergy immunotherapy, which is what typically people refer to as allergy shots.
Is it important to know what you're allergic to?
Yeah, if I am having trouble getting somebody under control with my standard treatments, when I send them to an allergy, they usually do what's called, or to an allergist, they do skin prick testing, where they have a whole series of vials and potions, and they do little squares, and frankly, I'm not totally sure what they do, but they end up with a diagnosis. You're allergic to dogs, you're allergic to trees, grasses, and molds, XYZ thing, and then they can direct the allergy immunotherapy.
Have you done that?
I don't even want to. I did do that, actually, and found out that I have non-allergic rhinitis. And so my next question was, well, then what is it that gives me these allergy-like symptoms? And they said, oh, things like dust and mold and pets. I'm like, isn't that allergy? And so I just stopped listening. I gave up. I have actually given up hope of ever figuring out how to control my allergies.
But they can test for that too. Dogs and mice and all that kind
They
of stuff.
did, and I came up as non-allergic to those.
You just have
But
a runny nose.
Yet I have the symptoms.
Right. But one of the bottom lines in that regard is that we treat it about the same. So for somebody who has allergic rhinitis versus non-allergic rhinitis, rhinitis is runny nose.
Okay,
What
good.
we might use is a nasal steroid. So something like fluticasone, which is Flonase, which can help decrease the inflammation in the nasal passages and stop that really irritating, aggravating drip down the back of your throat.
Amen.
Do most people who have allergic rhinitis, hay fever, are they able to control their symptoms pretty well with something over the counter? And how do you choose? There are a myriad of potentials out there,
Right.
The things that you could potentially use. How do you pick? And are most of them pretty good at controlling
most of them are
symptoms?
pretty good. And so typically what I recommend is a non-sedating antihistamine. So people either talk about Benadryl, which is diphenhydramine, which tends to make people pretty drowsy. So I try to avoid that because the vast majority of people need to be awake during the day. And so something like cetirizine, which is Zyrtec, or loratadine, which is Claritin, is non-sedating but can still help decrease that histamine response, which is one of the cell types or not cell type, but one of the mediators that can help cause these symptoms that people have. So I start with a daily medicine. I say be pretty proactive. Take it before you know your symptoms are going to start. So if you always, right around tax season, start to have allergy symptoms, maybe April 1st, start to take your antihistamine. And then go ahead and add a nasal spray if one of your symptoms is allergic rhinitis. And one of my main approaches is to choose the cheapest one. There's no reason to use the brand name. If you can find the cheapest fluticasone nasal spray, go ahead and use that one. And pharmacists at your local retail pharmacy can be really helpful in trying to help sort out what these different products are.
So it's a good idea to say, may I speak with the pharmacist and ask, get
I
their
think it's
recommendation.
really helpful
Yeah.
because, it's not too often that I find myself in the over-the-counter aisle, but when I do, I'm amazed by the vast numbers of products, and
True.
even that the same product might be labeled for a different function and have a different cost, even though it's all the same type.
And what about something like Zyrtec or Claritin that you take every day for the whole year? I mean, when do you get to a point where your body says, yeah, I'm not even paying attention to this medication anymore?
We don't think of it as something that your body gets used to. There are people that need to take the antihistamine year-round. There are some people that take it spring through fall, so from freeze to frost. And other people that might just need it, a weekend away at the cabin, for example.
What about, we've talked previously about using neti pots for various things where you actually irrigate out your, you do that?
Every day.
No.
I don't use a neti pot. I use a squirter bottle.
The Neilmed,
The
which I like
Neilmed,
that a lot.
and it's my favorite thing.
Really?
It's super
I
helpful.
think you're addicted. So,
There's worse things to be addicted
Absolutely.
to.
that's for sure. So does that help people
Yeah,
with,
it really
with
can.
allergies?
For people that have a lot of what people will describe as sinus congestion, the neti pot or the Neilmed, which is a nasal saline rinse, can make a big difference. I really recommend just using the rinses that are recommended on the package. So just sterile saline versus any additives to that. But it can be a great option to just help keep things cleared out.
Last question, and I think you pretty much answered it, and that is when to see a physician. And I assume that if you've tried these over-the-counter medications, multiple ones maybe, and they're not working, then would you send the patient to an allergist? Would that be the next step?
It often is the next step. Sometimes I try additional nasal sprays or drops that are prescription versus over-the-counter. So instead of a nasal steroid, doing a nasal antihistamine, for example. But if that's not working, I send them to an allergist, do more focused testing, and then we can talk about allergy immunotherapy.
All right. Does that help you, Tracy?
Sure it does. It's frustrating. It's frustrating. That's all I
I'm
have
sure
to
it
say.
is.
It is.
Well,
really is.
hopefully it helps our audience.
I hope so too.
All right. Seasonal allergies, Mayo Clinic Family Medicine Specialist, Dr. Elizabeth Cozine. Thanks so much for being with us.
Thanks again.